So hi guys, today I am with Manisha. Manisha has been with Personiks as our client as well as our patient. Welcome Manisha, and thank you for agreeing to talking with us. So Manisha, the first thing I would like to ask you is what is the problem that you were trying to solve, and how did you land up at Personiks?
So I have a mole, and that is diagnosed to be abnormal. And the doctors from the US, we usually live there. So when I consulted them, they called me and they said that it's a little cancer cells. There is a change in the mole, so I have to get it removed. I've reached out to doctor. She recommended that this is the best place to get treated. So I visited doctor here. So that's the story behind my visit.
Wow. So the doctors in the US were like suspecting that this could be a cancer.
Yes.
So that's
Actually, they called me and they said straight up that it is skin cancer and I have to get it re-excised.
That would have been very tormenting for you. It might have been like scared you so much. So since this was skin cancer, or they were suspecting so, and then you came with Dr. Guru, did you get another side of the diagnosis, or he also says that this is perhaps cancer?
No. The first time I visited him, he saw the report that I got from US and he reviewed it and he told me that it's probably not as serious as it is, and he suggested that I could re-excise it and send it to the pathology for a proper report again. So that comforted me a little.
Okay, yeah, just the possibility of a different diagnosis. Right. But since this was a cancer and this could be scary for you, and since you stay in the US, why did you choose to do this in India and not in the US? Like US is considered so hi-fi. So.
Right, no, but I feel the care and comfort here. I wouldn't find it in abroad. So the main point that I was here is there's no emotion or empathy when they are diagnosing me with skin cancer. But when I'm here, they're literally comforting me, saying it's probably not what you think. Don't think about the worst. It's not probably that. That's really comforting. And I have 2 kids, very small ones, and knowing that it could be as deadly as cancer and an aggressive form of cancer, that is very scary. So the day I left here, it relieved me a little.
Right. So I think in the care, it's not just the medical science, but also the entire, how the support you get.
I feel the technology and science is always increasing, and we can get it anywhere, but the care and comfort is the utmost thing that we can get in our home country.
That's beautiful. That's very, very interesting. Okay, and so when this was a possibility, you were in this gray zone. How did you get support from your family, and how did you break the news to them, and what are you doing?
I'm visiting India for my brother-in-law's wedding. So it's really hard for me to break the news to them, because especially we have a good thing going on there and I can't make them just say that it is cancer and scare them. So I did not want to tell them unless I get diagnosed here. So when I visited the doctor, they said it is probably not that, and we can see to it and surgically remove it. And they just followed me through the steps they are going to take me. So I was at ease to explain to the family that it is not serious.
Okay,
and I have 2 kids, so they're very small. Like one is 6 months, 5 months, and the other one is 2 years old. So it's not a good news to share with the family, especially this hard news.
Yeah, especially and when you're not very sure also.
Yes.
And when another doctor is telling you that there is possibly another diagnosis for this, right?
Yes. Especially that.
Right. That's really, really important, I think.
Yes.
And I think as women, we shoulder a lot of responsibility of the family members also.
True.
That they should not feel scared.
Yes.
And they should not start acting up.
Yes.
So I think taking decisions for yourself also until you have clarity is also a good way to deal with too many emotions.
True. I did not have much information. They just called me up and they said, yeah, it's just a skin cancer and we have to do a surgery on you. That's the only thing that I got from them. That's the only information that I've ever got. So they did not explain which stage it was or what's the treatment that I have to undergo and all. So that's something that Dr. Guru took me through.
That's very, very important, right?
Yes.
Okay, thank you. So what is your message to the people, either who are not open for cosmetic surgery visits or what is in general from your experience?
So the doctor who recommended me here, the main reason is because the mole is in the center of the body, and it might affect even if I breathe. So she wanted me to go to the surgeon because it is cosmetical. I mean, the way it is or the place it has to be properly done. So only a plastic surgeon can have that experience or the knowledge to do it. And even if I wear the dresses that expose a certain area, it would really look nice. So I don't think there's something to be scared about to reach out to a plastic surgeon, especially when it excludes the confidence that we want to wear ourselves.
Yeah, right. And I think we underrate a lot about how we are confident in the clothes that we wear and how we present. So, because generally,
It's just not a cosmetic surgery, but it has a lot of, science behind it, and whatever they do, they have that experience to do. So, it's not something to be scared about.
right. And I think going to a qualified surgeon really helps to do that, right?
Yes.
But, excellent. Okay. And just one last question. When it came to financing the whole procedure that you wanted to do and things like that, in India, a lot of these procedures don't get covered by insurance, but you still manage to kind of do that. So is there anything that you would like to tell women about how they can leverage their financial freedom to make choices that they would want to make?
Personally, I would say if there's an insurance that we can afford to before going to these treatments, I think that would help a lot. But and treatment itself here, I did not find it very costly or something that they're going overboard. It's very reasonable, so I think it's the best that we can get. I'm saying that few treatments in US, they are not covered by the insurance that we already might have had. So we still have to go out of the pocket. So, but here in India, I felt this is very reasonable. So today I got my husband here to get skin tight remove as well. Because I feel that it is costly in US, so the prices are reasonable. They are not overboard.
Okay, wonderful. Thank you so much.